Hello, everyone. I am Kristi Fox with the Orlando International Film Festival, and I am here to go over some information regarding COVID-19. Before getting into the nitty-gritty, let's cover the disclaimer. COVID-19 is an evolving condition. The information contained in the following slides includes the most available, updated information at the time this was prepared. This information does not replace the advice or consultation with your physician regarding diagnosis or treatment. Consultation with your physician is advised. Here is the overview we will be covering. What is COVID-19? Definition, symptoms, high-risk patients, mitigation, prevention, mental health side effects, vaccination, testing, tests, testing centers, results, do I need to get tested? Should I get tested? Quarantine versus isolation, tracking, possible beginnings, timeline, forecasts. So what is COVID-19? Definition: COVID-19. Coronavirus disease 2019 is caused by a specific strain of coronavirus called SARS-CoV-2. Coronaviruses are a large family of viruses that cause a variety of respiratory illnesses, which include the common cold, SARS, and MERS. It is an RNA virus, which means it is a single-strand virus that hijacks the human cell to replicate. Symptoms include cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste, new loss of smell, confusion, numbness in the arms or legs. Symptoms affecting children include fever, irritability or decreased activity, stomach pain, diarrhea, vomiting, rash, pink eye, poor feeding, red cracked lips, bumpy tongue, swollen hands and feet, possibly red. It is important to note some general information of COVID-19 symptoms like first appeared primarily in the adult population, none to mild severe range of symptoms reported. 80% have none to moderate symptoms which require no hospitalization. May take 2 to 14 days to manifest. Individual symptoms vary. Additional symptoms include nausea, vomiting, or diarrhea. High-risk patients include 60-plus individuals, people in long-term care facilities and nursing homes, people of color, and individuals with underlying health conditions. The underlying health conditions that cause high risk for the virus are the following: heart disease, chronic lung conditions such as asthma, COPD, immunocompromised conditions such as cancer or cancer treatment, HIV, smoking, transplant patients, prolonged use of immune-weakening medications, severe obesity, diabetes, chronic kidney disease undergoing dialysis, liver disease. When to seek emergency care or medical attention: when you have trouble breathing, chest pain or pressure, new confusion, an inability to stay awake or to wake someone, bluish lips or face, seizure, paralysis of the limbs, or difficulty talking or swallowing. Seek emergency care or medical attention for children if there is persistent high fever or severe stomach pain. Let's cover mitigation. 5 sections will be covered on individual prevention measures: wash hands, clean and disinfect, avoid touching face coverings, physical distancing. The first individual measure is washing hands. For washing hands, lather soap onto hands for no less than 20 seconds, at least to the wrist. Do so often. The best steps for washing are wet hands, apply soap, rub palm to palm, interlace fingers, wash hand backs, rub thumbs, wash fingernails, rinse with water, and dry. Secondly, one should clean and disinfect. Make sure to clean surfaces with water and soap before disinfecting. Routinely clean especially high-touch surfaces, such as light switches, keys, doorknobs, and phones. Use EPA-registered household disinfectants with 70% alcohol. The third prevention is avoid touching the face. Virus droplets from touch surfaces can get into the body through eyes, ears, nose, and mouth on one's face. The fourth preventative measure are face coverings. Make sure it covers mouth and nose. If you are in a community setting, you should wear a mask. If you are ill or sneezing and coughing, then wear a mask, even at home. If you are taking care of one with COVID-19, wear a mask. Important tips: clean hands before putting on. Avoid touching the front of the mask while wearing and removing. Include multiple layers of fabric and routinely wash. How to make a face covering. Face coverings require these materials: cotton cloth, elastic, and needle and thread. Follow these steps to create a face covering. Place 3 pieces of 20 by 20 inches cotton cloth together. Fold in half. Fold top third down and bottom third up. Sew sides together. Place elastics onto edges. Sew elastics. For visual instructions on making a face covering, check out this DIY video. Lastly, for individual measures is physical distancing. Limit face-to-face interactions. Stay at least 6 feet apart. This does not include people sharing a residence. No large gatherings. Avoid crowded places. Try to stay home and stay socially connected. Though physical distancing is important, it can be damaging to one's mental health. Therefore, it is vital to know the problems and how to combat them. The negative mental issues arising from this pandemic affecting people mentally are listed below: social isolation, impact of pandemic, fear, uncertainty, rumors, loss of life and grief, domestic violence, which has increased 30 to 40%, students and children, job loss or job jeopardy. Additionally, loss of income, essential workers in regards to job stress, intense environment due to loss of life in excess hours, overwhelmed, substance abuse, anxiety, health concerns, depression, and suicide. In these times, focusing on self-care is essential. Here are some techniques focusing in self-care. Deep breathing, take a break, avoid overexposure to COVID-19 news and media, exercise, prayer, meditation, sleep, and stay connected. Seek professional help with crisis hotlines, virtual therapists, and spiritual guidance. Please remember, if you have a pre-existing mental health condition, you should continue your medicine and ongoing care. Mental health does not only include adults. Remember, children's mental health care is just as important. Therefore, talk with them. Share age-appropriate information, reassure them, monitor social media outlets, debunk rumors, be a good example of self-care, and continue social connections with loved ones and friends. When to seek help for mental health. If the following symptoms persist for several days and you are unable to carry out normal activities, seek professional help. Feelings of numbness, anxiety, fear, and disbelief. Changes in energy level, anger, and hopelessness, difficulty concentrating, sleeplessness, nightmares, or upsetting thoughts or images, worsening of chronic conditions, stomach aches, rashes, nausea, headaches, backaches, and an increased use of substances like alcohol, tobacco, and other drugs. There are numerous resources to reach out to for help. Here are some of the hotlines available to call. 7 sections will be covered on national prevention measures. Those are stay at home, mandatory face covering, avoid large crowds, online education, events canceled or changed, non-essential store closures, and restaurants with limited dining, takeout, and delivery. First and foremost, the national measure of staying at home. Each state has its guidelines, rules, curfews, and end dates vary. Residents must stay inside. Examples of reasons for residents to leave their homes are to shop for essentials like groceries, to exercise outdoors as long as one stays 6 feet from others, to go to the doctor, and to pick up prescriptions. Residents may go to work that is deemed essential. You may need to make individual choices regarding your own personal circumstance. Next, mandatory face coverings. Some states require face coverings out in public. People required to wear face coverings varied according to locations. It can be essential business employees to all residents. When mandatory and enforced by law, punishment varies per state. It can be warnings, fines, or jail time. Avoid large crowds is the third national prevention measure. It is an attempt to flatten the curve and to keep the infected at a manageable level. It is a recommendation from the Centers of Disease Control and Prevention and an aspect of physical distancing. Additionally, education has shifted to an online format. Beginning in March 2020, some schools suspended all face-to-face schooling for the 2019-2020 academic year. However, some set to reopen mid-May to late May. Some universities shut down campuses and vacated housing. Classes pushed to online format for spring and summer semesters and are considering options for fall 2020. Some events have been canceled or changed. These include wedding venues, sporting events, cultural events, concerts, conventions, festivals, and movie releases. Next, there have been selective non-essential store closures across the country. These are generally recreational. The definition of essential versus non-essential depends on the cities and states, and the number of closures varies per state. The last national prevention measure involves restaurants. Restaurant options include closed dining or limited dining, takeout or delivery, curbside takeout, no contact delivery, but regardless, workers are required to wear masks and gloves. 3 sections will be covered on international prevention measures. These sections are some countries on lockdown, some closing of borders, and mandatory 2 weeks quarantine for returning citizens. Some countries on lockdown. This means one should stay at home, only leave if it is necessary, and it is enforced by law. Some closing of borders is occurring, thus resulting in travel bans to other countries, strict internal travel, and suspended visas. Mandatory 2 weeks quarantine for returning citizens. This is issued by various countries worldwide. It is a safety precaution and can transpire at home or at a quarantine facility. All safety measures are in place to flatten the curve. Flattening the curve allows for appropriate health response to the crisis. Vaccines are to be developed later. The COVID-19 vaccine is in development. There are more than 100 vaccine candidates and 8 vaccine methods, and some are in human trials. If the human trials present positive results, then it is likely an emergency vaccine could be finished early 2021. Unfortunately, there are complications to this vaccine. Vaccines usually take 3 to 8 years to fully create. COVID-19 is a mutating RNA virus. This causes difficulty developing a vaccine against it. With mutation, the length of immunity given by a vaccine varies. There are more questions than answers regarding the COVID-19 vaccine. Will the human trials be successful? Will they not be? What will go wrong in the development process? Will the emergency use authorization from the FDA be approved? How long will it take to create in large quantities? How long can the vaccine protect someone from the virus? Will it be effective? When exactly will it be available? Can we really expect a new vaccine to be created in 12 to 18 months? Is that realistic? Is it safe? Let's dive into testing. There are two main types of testing: viral antigen tests and antibody tests. Viral antigen tests are viral PCR tests for current infection. It detects virus genetic information and is a nasal swab. It looks like a Q-tip tool and swabs inside of the nose for 15 seconds. It reaches all the way to the throat's upper part. Antibody tests examine the blood for past infection. It is a serology blood test that uses a blood sample to detect antibodies resulting from COVID-19 exposure. To get tested, one goes to a testing center. Testing centers are located in counties across any given state. An appointment may or may not be required. A referral is sometimes required. Drive-through options are available. It is recommended to call first. Following visitation to a testing center, the waiting begins for the results. For viral antigen tests, the wait time for results vary per testing center. Average wait time is 3 to 7 days. If seriously ill in a hospital, the wait time decreases to 12 to 24 hours. If positive and currently infected with COVID, take precautions. One can have a persistent positive. This means that it is unknown if currently infectious. If negative and not infected at the time of the test, you are still at risk. While waiting for tests, it is smart to take precautions like self-isolating for 14 days or until a negative test. For antibody tests, the wait time is 1 to 3 days. If positive, you have been infected with COVID-19 in the past and have some immunity. However, the length of that immunity may vary. If negative, you have no previous infection, but are still at risk. Do I need to get tested? Testing depends on severity of sickness, occupation, and if one is caring for the vulnerable population. However, a state or given country may require one to be tested if one has been in contact with a person known to have the virus or one has recently traveled. Additionally, the safety measures of quarantine or isolation may be asked or ordered to take place. Quarantine versus isolation. Quarantine separates possible exposed individuals from others. They showcase no signs of sickness. It helps stop the spread of the virus. Self-quarantine is voluntary. Quarantines are sometimes mandatory by governments depending on personal situations. Isolation separates sick individuals from the non-infected individuals. These people are sick. It helps stop the spread of the virus. Isolation can be voluntary or ordered by the government. A question you may ask yourself is, should I get tested? Therefore, it is important to know that the majority can recover at home without medical care. The majority will experience none to mild illness symptoms. However, if severe symptoms occur, seek medical help. Call a healthcare provider. Call 911. Go to a testing facility. Go to the hospital. Let's review tracking of COVID-19. Possible beginnings in December 2019. It has a zoonotic source and developed naturally from wildlife. Earliest cases linked back to wholesale food markets. On December 31st, there were confirmed cases in Wuhan, China. On January 7th, the outbreak was identified as the new coronavirus. The first known death occurred on January 11th. On January 13th, cases were confirmed in Thailand, Japan, and South Korea. On January 17th, airports began health screenings. January 21st, 2020, first confirmed case appeared in the United States. On January 23rd, Wuhan is placed under quarantine. On January 24th, the first confirmed cases appear in Europe. On January 30th, the World Health Organization declares a global health emergency. On January 31st, the U.S. declares a public health emergency. On February 2nd, the first confirmed death occurs outside of China. On February 6th, the first confirmed death occurs in the U.S. On February 11th, the virus's formal name was announced. On February 23rd, Italy locks down. On February 29th, the FDA opens up testing. On March 6th, event cancellations begin. On March 11th, travel bans begin on Europe. On March 13th, the World Health Organization declares a pandemic. On March 16th, online education begins. On March 19th, U.S. physical distancing and stay-at-home begins. On April 2nd, more than 1 million cases are worldwide. On April 8th, lockdowns begin to lift. On April 15th, more than 2 million cases are worldwide. On April 21st, the U.S. stay-at-home orders begin to lift. Case numbers are still increasing as of May 1st, 2020. Forecasts. For the United States, peak times vary per state, but a strong second wave is possible. For worldwide, peak times vary per country. Predictions going forward, there's no real way of knowing. There are too many variables. COVID-19 is a deadly pandemic plaguing the world. Therefore, it should be taken seriously. As this presentation comes to a close, I would like to remind everyone to stay safe and protect each other.